you have called Obamacare a threat to health, liberty, and financial stability. Why do you feel that way?
Well, recognize one of the things that is critical about the welfare of this nation is knowledge. And you need to be extremely well-read in lots of different areas. You need to understand what are the principles of freedom. One of the key factors in creating a government that is controlled, that has the ability to control the people, particularly if you look at the writings of neo-Marxists, healthcare. Number one on the list. Take control of people's health care. That makes them dependent. My point is not that we shouldn't provide health care for people. I very much believe that we have the ability to provide health care for everybody. We pay more than twice as much per capita for health care in this country as the next closest nation. There's a lot of waste, a lot of fraud. There are ways to do this where we leave the health care in the hands of the people and not in the hands of some faceless bureaucrat.
How do we fix it?
I totally agree with the premise of your question. There are a lot of things that are wrong, including having a system where one of the major pillars are companies that make money from denying people care.
Yes.
That makes no sense whatsoever. Okay, so we need to fix that. But the way to fix that is not to create a gigantic government bureaucracy, which will be even bigger than the VA, and you put all these layers of bureaucrats between patients and the healthcare providers.
How do we fix that? I'm sorry, go ahead, Jerry.
Well, let me give you an example.
Go ahead.
Health savings accounts. In a health savings account, you, the individual, have the ability to spend the money the way you want to spend it. So you pick the doctor that you want to see, you have the services that you want to have, but it comes out of that. You sprain your ankle and you think you need an x-ray? That's coming out of your HSA. You know, you need a physical exam for a new job? That's coming out of your HSA.
You know, my stance on insurance companies, what I stated is it doesn't make any sense to have insurance companies that make profit by denying people care that they deserve. So, you know, that's a conflict of interest, and we need to have a system that does not include that conflict of interest. The reason that I've been so adamantly against Obamacare is not because I don't want people to have good care. I want everybody to have good care. We spend twice as much per capita on health care in this country as the next closest nation, and yet we have terrible access problems. I think that Obamacare is not about access. I think it's about control. They want to control people's lives. Otherwise, they would have recognized that 85% of people already had health care that they were satisfied with, and there were only 15%. And you could have covered those people with a lot less money than went into this whole program. That's a fact. So, having said that, I never like to complain about anything without having an alternative. And that's why I've advocated the use of health savings accounts, that you get the time of birth and you keep until you die. And we already have mechanisms to pay for them using the same traditional methods that we use to pay for them now, but it wouldn't require as much. And you give people flexibility in their health savings accounts so that if dad's $500 short, mom could give it to her out of hers, or uncle, or cousin, or daughter. Anybody in the family, each family becomes their own insurance company. That way it gives you enormous flexibility. 80+% of all encounters with the healthcare system could then be handled that way. And that would leave your catastrophic insurance to only handle catastrophic things, which means the cost of it goes down enormously, like a homeowner's insurance policy with a big deductible. And that's the kind of thing that really begins to make sense. And now you say, okay, I can see how that works for the vast majority of people, but what about the indigent? What are they going to do? They don't have jobs. They don't have a way to fund their HSA. Well, simple. The annual budget for Medicaid is $400 billion. About a quarter of the people participate in it. That's 80 million. 80 million into 400 billion is 5,000. $5,000 for each man, woman, and child, you could buy a concierge practice for every single one of them, a boutique practice, and still have thousands left over for catastrophic insurance. I'm not suggesting we do that. I'm showing you how much money we're already allocating, and if we begin to use that in an intelligent fashion, then we begin to address those kinds of issues. Is health care a right? No, it is not. But it is a responsibility for a compassionate society, and we are a compassionate society, and we can do it for a lot less and make it much more effective for everybody.